Hello everyone. Today our topic is anti-hypertensive drugs. Now what is meant by hypertension? We all are quite familiar with the term hypertension. Hyper means increased tension, of course. Here it means that the tension has increased in the blood vessels, specifically in the arteries. Now when we can say that there is hypertension, whenever the consistently we are measuring the blood pressure via sphygmomanometer and we are checking that the systolic blood pressure is always greater than 140 mmHg and the diastolic blood pressure is always greater than 90 mmHg. In that condition we call it to be hypertension. But yes, it cannot be that once you are measuring and you are saying a person is suffering from hypertension. No, it's not that. It has to be subsequently happening. Means you are recording for one day, next day, like this. If you are constantly recording and you are finding the readings are coming in that manner, then you can actually say that the person is suffering from hypertension. Now the causes or the etiology of hypertension. What can be the causes? You can see most important cause, that lifestyle disorder. Diabetes mellitus, mainly the diabetes mellitus, which is type 2, that is also a type of lifestyle disorder that is happening. And hypertension on the other hand, that is also a type of lifestyle disorder. Though there are chances of genetic history or family history, but mostly they are classified as under lifestyle disorder. You can see excessive sodium intake, like some people prefer more salt in their food and they're constantly consuming more salt, so automatically that person has higher chance of suffering from hypertension. Then obesity, smoking and alcohol consumption, so these are also other causes that promotes this hypertension. Now what we have to understand, that what is this arterial blood pressure. As we are saying that hypertension is generally we are measuring for the arteries, because that pressure is more in the arteries than in the veins. So that's why arterial pressure, we know that it is basically the product of cardiac output and the peripheral resistance that is offered. So in cardiac output, if you can say cardiac output, what is this cardiac output? Cardiac output means we can know that the stroke volume in every cardiac cycle, the heart, specifically the ventricles, they are pumping the blood, okay, and that amount of blood which is being pumped, that blood is coming out in each cycle. So we take a time duration of suppose 60 seconds and we calculate that within 1 minute what is the cardiac rate, okay, that the heart rate, what is the heart rate, and accordingly we calculate the cardiac output, and that cardiac output comes out roughly around 5 liters per minute, that is roughly 4.5 to 5 liters per minute. So that cardiac output, when it is multiplied with peripheral resistance, the resistance offered in the blood vessels throughout the body. So the cardiac output of course depends on the heart rate, as I have mentioned. Then the contractility of the myocardium, that is also an important factor. And you know that blood volume, venous tone, all these regulate something called as the filling pressure. That is the pressure exerted when the ventricles are being filled with blood. So all these have an impact on the cardiac output. And the arterial volume, that is the volume of blood that in the arteries, that will regulate the peripheral resistance. You can understand, if peripheral resistance, if cardiac output is constant, if peripheral resistance is higher, then arterial blood pressure will also be higher. So we can first we have to understand that what is the general mechanism of controlling hypertension, or if there is suppose fall in blood pressure anytime, then what is the general physiology of the body, the general reflex that gets activated in our body to maintain that blood pressure, because anytime there can be some sort of hypotension in the body. So that hypotension is compensated by certain reflexes. One of the important is the baroreflex, that is mediated by the sympathetic nervous system. We have baroreceptors mainly present in the common carotid artery, where it actually bifurcates into the external carotid and the internal carotid. Mostly in the common carotid and in the internal carotid, we get to see the baroreceptors present. And we have the chemoreceptors in the arch of aorta, and some baroreceptors are also there. So whenever there is fall in blood pressure, now there can be some sort of hypovolemia, there can be a hypovolemic shock. For these reasons suddenly the blood pressure can fall, and whenever the blood pressure is falling, so the baroreceptors, they can sense it, then suddenly the blood pressure falls. So automatically what will happen, the sympathetic nervous system will get stimulated and that will cause vasoconstriction. So whenever vasoconstriction is increasing, then the peripheral resistance automatically increases, and automatically the arterial blood pressure will also increase, and hence the cardiac output, you can say that if vasoconstriction increases, then cardiac output will also increase. So that is whenever there is sudden fall in blood pressure. Similarly, another important system is there, that is called as the renin angiotensin aldosterone system, RAAS mechanism. So here also you can have to understand, this is also quite important in our body for maintaining the blood pressure. First is the baroreceptor. Kidneys, the certain cells, the nephrons also have baroreceptors present. Okay, and whenever there is this fall in BP, I am saying that whenever there is fall in blood pressure, then what will happen? These baroreceptors present in the kidney, they will actually react to that sudden decrease in blood pressure, because the renal artery and the further arterioles and all those glomerulus and all there, of course the pressure will decrease. So that will be instantly sensed, and the kidneys will actually release renin from the juxtaglomerular apparatus. Renin will be released. Remember, this is renin, renin, and not renin. That was basically an enzyme associated with the digestive system. So this is renin, renin. This is released, and what will this cause? Something called as the angiotensinogen, which is produced from the liver cells. Okay, the hepatocytes produce angiotensinogen, and that angiotensinogen in the presence of renin is converted into angiotensin 1. Now this angiotensin 1 in the presence of angiotensin converting enzyme, that is produced from the pulmonary endothelium, or from the lungs, you can say. From the lungs this ACE is coming, ACE, and that is converting angiotensin 1 to angiotensin 2. So whenever angiotensin 2 is produced, which is it's a quite powerful vasoconstrictor, and that will automatically increase the level of aldosterone in the body. Okay, aldosterone that will be released from the adrenal gland. So aldosterone will increase, and that will facilitate sodium absorption. When sodium absorption will increase, automatically the blood volume will be maintained, because sodium's uptake and sodium's release, that is sodium is been taken by the cells, by the nephrons, and sodium is released. So these actually have effect on the water, as we know about the counter current mechanism. So automatically when sodium absorption will increase, water will also be retained in the body, so the blood volume will increase, and this will increase the blood pressure. So you can understand, if there is a fall in blood pressure, one, that is the baroreceptors present in the common carotid artery, there they will get activated, sympathetic activation, and other way around, here renin is produced, and automatically the RAAS mechanism will activate, and the blood pressure will increase. So that is normal physiologically happening. Whenever there is certain case of hypotension in the body is trying to increase its pressure. Now we are coming to our main topic, that is anti-hypertensive drug. But what happens when if this system can fail? So this system can fail, so that is a separate story that we will not discuss here. Here we will discuss about if due to any reason the pressure in the artery is increasing, that is we are suffering from hypertension. So what can be the medicines applied? So all these drugs and all, they have the impact on this system only, RAAS system and the baroreflexes. So here only all these drugs will activate and work so that the blood pressure can be decreased, because hypertension is a very common type of disorder that is happening in each and every household, mostly because of the stressful lifestyle. Now talking first about the diuretics. Diuretics means those substances which are basically promoting more urine excretion, right? When more urine is being excreted, those substances are called as diuretics. Now see, there are different classes of diuretics we have to see. One is the carbonic anhydrase inhibitors, like the acetazolamide, that is one drug. Loop diuretics are there, thiazide, potassium sparing, osmotic diuretics. So about diuretics I will not discuss in details, but that most important thing that you have to keep in mind is about the thiazides. Whenever thiazides come in your mind, you have to remember hydrochlorothiazide. There are chlorothiazides also, hydrochlorothiazides, but most importantly hydrochlorothiazide that is used. and also indapamide that is used, because these substances, they will actually promote excretion of sodium, and along with sodium water will also be excreted. So what will happen, the blood volume will automatically decrease, so the blood pressure will also decrease. So this is one medicine. But you see, you cannot apply diuretics to every person. First you have to check whether that person is suffering from any other sorts of disorder, like if there is congestive heart failure or not, if there is some renal problem or not. So all these things you have to check whether the person has diabetes or not, because you see, there are certain adverse effects, like they will promote hypokalemia, then hypertensive diabetes. So in these cases you cannot apply diuretics directly, right? And also if you are applying diuretics, you have to check whether the kidney is working properly or not, because that will affect the renal functioning, as well as there can be any sort of heart problem also. So certain adverse effect, whenever you are giving or prescribing a medicine, you have to check whether that person is suitable with that, because there can be side effects of that medicine. So you have to look into that. Then another important medicine that we see is the beta adrenoreceptor block. Now what do you mean by this beta adrenoreceptors? When we will discuss about this mainly in the nervous system part, but keep in mind this much, that there are beta receptors, adrenaline sensitive, noradrenaline sensitive beta receptors, beta 1 and beta 2 receptors. So when we will block these receptors, automatically the sympathetic outflow, because these are adrenaline and noradrenaline related with the sympathetic nervous system. So whenever the adrenal receptors are blocked, then the sympathetic outflow will decrease, and that will decrease the amount of renin also. Why? Because sympathetic supply is there throughout the body. For every organ we have the sympathetic and parasympathetic supply. So in sympathetic outflow, if it is decreasing, then that will actually inhibit renin's flow. So when renin is not there, you can understand that this entire mechanism, RAS mechanism, will not function, because renin will not be there to convert angiotensinogen into angiotensin 1. So automatically this entire process will not happen and blood pressure will not increase. So this can be used, and the most important drug that we use for beta adrenoreceptor block is the propranolol, okay, which acts on both beta 1 and beta 2 receptors. Then you see the adverse effect, okay, or the side effects. If the person has asthma or any sort of angina, like there can be unstable angina or angina pectoris, then in those cases you cannot give the person these beta adrenoreceptor blockers, okay. Then we have the ACE inhibitors, that is angiotensin converting enzyme inhibitor. Now you will work over here. If you inhibit this step, then automatically again this entire RAS mechanism will not function. So amongst ACE inhibitors we have captopril, enalapril and lisinopril. Here I am not discussing that in which category of patients you have to prefer which type of drug, because that we are not discussing here. I am giving an overall idea of the drugs that are mostly used. So here captopril, enalapril and lisinopril, these are used because these will directly inhibit this ACE, angiotensin converting enzyme, and automatically in that case, when this will be inhibited, there will be chances of vasodilation, blood vessels will dilate. So automatically what will happen, there will be arterial volume will decrease, the peripheral resistance will decrease, and in this case the blood pressure will also decrease. But again here in case of renal failure you cannot give ACE inhibitors, because that will actually, in that case what will happen, if ACE is inhibited, then automatically there will be no sodium absorption, right? So when sodium absorption is decreased, so there can be problem, because sodium also has to be retained in the body, and for maintaining the counter current mechanism, and sodium is very important, and we all know for depolarization we need sodium. Sodium has many other functions also in the body. Next and most important category of drug that is used across, that is the calcium blocker. Now this calcium influx to the smooth muscles, whenever you understand the blood vessels are there, so there we have the smooth muscles present. So though in the smooth muscles there the calcium influx, because calcium is required for contraction of the smooth muscles. So whenever the calcium influx, the calcium ports, the calcium channels that are present, if they are blocked, then what will happen, the influx will not be there, calcium can't enter into the cell, and automatically there will be no contraction. So you can understand that the resistance will decrease, vascular resistance will decrease due to vasodilation, because there will be no contraction. So they will dilate, try to dilate, there will be no contraction, and automatically there will be less blood pressure. So amongst calcium blockers we have verapamil, we have nifedipine, and we have nicardipine. So these are the drugs used. Amlodipine, that is also used as a calcium blocker. But remember, if the person is suffering from heart failure, congestive heart failure, then you cannot give verapamil. Okay, verapamil cannot be given at that point of time, because that is automatically, that will stop the heart functioning also, because in the cardiac muscles, there also what will happen, the calcium influx will be stopped and they will also not be able to contract properly, so that will worsen the case of heart failure. So you cannot give verapamil in case of the congestive heart failure patients, right? So that was about the drugs. One important thing that I want to mention is in the emergency hypertension, which is very rare but it is quite fatal. So in that case, just remember the name of these two drugs. One is the sodium nitroprusside, which is given intravenously in case of emergency, and we have the diadoxide. Okay, that is also given along with some beta adrenoreceptor blockers, that is also given in case of emergency. And emergency hypertension has to be treated immediately, or else what will happen, the hypertension will be so much. So you can understand the effects of hypertension. There can be an organ failure, like if the hypertension is increasing, the automatically might be the arteries, ophthalmic arteries and all, they are causing more pressure, so automatically the pressure inside the eyeball chamber will increase, that will lead to blindness. If there is increase in hypertension, that will lead to renal failure. Okay, so automatically many things are affected. Liver problems will arise due to hypertension. So we have to keep in mind that hypertension, we have to try to reduce it, and the best method to reduce hypertension, that is homely remedy that we can follow. We have to keep away from this stressful lifestyle. So what we can do, we can actually meditate, right? We can meditate, we can practice yoga and all, so that our mind remains relaxed and also our body remains fit, so that this kind of hypertension can be avoided. Okay, thank you.